aorta, as I was just explaining, I will utilize some acoustic gel. Put it into, place the transducer on my abdomen and demonstrate the sagittal or longitudinal proximal aorta. So in this instance, on this side of the screen, I would put SAG, OA for aorta, P for prox, or you can write out PROX. That image shows the proximal aorta in its longitudinal plane or sagittal plane. This particular side of the screen shows the same location, the proximal aorta, but it's scanned in the transverse or TRV plane. So if you look closely at both of them, you have the longitudinal or long plane of the proximal aorta on this side of the screen, and by turning the transducer notch to the patient's right side, you get a cross section of the proximal aorta, which turns that into a circular appearance. After you are complete with your patient's ultrasound exam, you will again click the End Exam button, take a towel, it could be the towel that you use on your patient, and just wipe off any excess gel from the transducer. And then you'll utilize some type of disinfectant cleaner. In this case, Protex will be used on everyday patients, to include patients with MRSA. If your patient has C. diff, you will use a Clorox or bleach-based solution. When you clean your transducer, you want to make sure you clean every part of your transducer, to include the top. And if you notice closely, there's a little notch there. Do you see the gel that's in there? A lot of times sonography students and sonographers miss that portion on a probe, and that gel could possibly be transferred from patient to patient. So make sure you clean that part of the probe as well, to include the cord all the way down, potentially to where it is in the port. As always, make sure you're using gloves when imaging and utilizing your ultrasound transducer. And as you can see, this ultrasound transducer is pretty clean. There's nothing located in that little area again, and it's ready for use on the next patient. When you're done with your probes, make sure your probes are cords are all off the floor, to prevent any cord from being stuck in the wheel of your transducer, or in the wheel of your machine, or being caught in an elevator door. There are loops on your machine here in the front and here in the back that you can loop your cord from your ultrasound transducer into it, just to remove it from the floor. When you are done for the day, make sure your rooms are set up and prepared for the next business morning. Make sure you go turn off your machine by pressing this button. Make sure you fill your gel bottles for the next business day. Turn off your light and prepare to exit the room. This is all for now. I hope you've enjoyed this intro to sonography videos. Stay tuned for more to come.